So good afternoon, everyone. Thank you so much for making the time today to join us live here at the Wallington Public Schools 2025 Open Enrollment presentation. My name is Elizabeth Roldan. I am here from IMAC Insurance. IMAC Insurance is the insurance broker for the district's health benefits. So any questions that you may have related to your medical, prescription, or dental benefits, please feel free to reach out to our office. We are also here to help you with any claim matters that you may be experiencing. So if you have a claim situation, whether it's something for prescription that you're having trouble filling a drug at the retail pharmacy, or if you're having an issue with, let's say, a pre-authorization, reach out to us. We actually encourage members to reach out to us first because if you call Horizon Direct, you're probably going to spend a lot of time on hold. So we encourage you to reach out to us. We are most likely able to get you an answer much quicker and look into your matter with the team that we have dedicated to your account at Horizon Direct. So please feel free to reach out to us. You can give us a call at 973-450-9800, or you can send us an email to info@imacagency.com and we will get back to you. Especially now during your open enrollment opportunity, which is every year, we are answering people back in real time. I've already gotten a few phone calls and questions about the educators plan and how that compares to Direct 10, which I know that's one of the big things that we're going to be touching upon today. So definitely please feel free to reach out to us for anything related to your medical, prescription, or dental benefits. Open enrollment began this week on the 27th and will be going through November 21st. That is a Friday, so please make sure that you are aware of that if you're looking to make a change. That is the Friday before Thanksgiving week. And any changes that you'd like to make have to be made on the Horizon enrollment form. Your medical, prescription, and dental are all with Horizon. So if you're looking to enroll for the first time or make a plan change or add or remove any dependents, that Horizon enrollment form, which is also on the IMAC benefits portal, is the form that you'd be using to make those changes and submit that back to Edita in the administration office. While this is a passive open enrollment that doesn't require any action on your behalf, because if you take no action, the way that your benefits are today is how they will carry over into 2026. We do encourage everyone to just take a look at everything that you're enrolled in, as well as your dependents, to make sure that everything is as it should be. Also, if you're making a plan change, please let us know if you have an address change. A lot of times when employees are making a change to their benefits, they don't let us know that they've moved. And then when you get new ID cards, they get lost in the mail because they're not going to the correct mailing address. So if you've had a change in address, please make sure that you're noting that on the Horizon enrollment form as well. And if you do waive your coverage, you do have to complete and submit a waiver form as you do annually. This year during open enrollment, you will have the same 4 plan options that you currently have, which are the NJ Direct 10, the NJ Direct 15, the New Jersey Educators Health Plan, and the Garden State Health Plan. If you are someone that was hired at the district on or after July 1st of 2020, the New Jersey Educators Health Plan and the Garden State Health Plan are the only 2 plan options that you have. But if you were hired prior to July 1st of 2020, you can elect from any of the 4 options being offered. Something that I always like to touch upon during open enrollment is that if you're currently in Direct 10 or in Direct 15 and you go to the educators or the Garden State Health Plan, you can always go back to your Direct 10 or Direct 15. There's a bit of a misconception out there that if you leave Direct 10, for example, you can't go back into it. And everything is based on your date of hire. So as long as you were hired prior to July 1st of 2020, you can elect from any of the plan options during open enrollment every year. We also have detailed plan comparisons of all 4 plans on the IMAC benefits portal. So I highly encourage you to take a look at that if you haven't done so already. One of the largest or biggest questions that we get every year during open enrollment is why is the New Jersey Educators Health Plan and the Garden State Health Plan less expensive contribution-wise than the Direct 10 and the Direct 15? So if you look on the left of this graphic, Direct 10 and Direct 15 take into account when you're calculating your contributions with what's called Chapter 78, they take into account your coverage tier. So if you're covering single, family, 2 adults, parent and child coverage, your salary, and the premium of the plan. So every year that the premium goes up, if you're in Direct 10 or in Direct 15, your contributions will be increasing as a result of that premium increase. But for those that are in the New Jersey Educators Health Plan or the Garden State Health Plan, the only two factors that determine their contribution are, again, their coverage tier. So if they're covering family, single, two adults, parent, and child, and their salary. So even though the premium for New Jersey Educators Health Plan and the Garden State Health Plan also increases every year, because the premium is not a factor in how that contribution is calculated for those two plans, employers only see a change if their salary increases. So Direct 10 and Direct 15 is a percentage of the premium, whereas the educators and the Garden State Health Plan is a percentage of your salary. So anyone moving to the educators or the Garden State Health Plan, it has a guaranteed savings in their current contributions from Direct 10 or Direct 15 because of the way that they're calculated. Direct 10 and Direct 15 calculate everything based on Chapter 78, where the New Jersey Educators Health Plan and the New Jersey Educators Health Plan and the Garden State Health Plan calculate at what's called Chapter 44. We do have the IMAC benefits calculator on the IMAC benefits portal. So if you haven't had a chance to look at it, I highly encourage you to do so. But feel free to reach out to us as well. We would need your salary information and whether you're covering family, parent, child, two adults, or parent and child coverage in order to determine and let you know what you would be saving if you would consider moving into the educators or the Garden State Health Plan. And as I mentioned, because the New Jersey Educators Health Plan and the Garden State Health Plan are both based on a percentage of your salary. For example, if you were in the Educators Plan and you have a $75,000 income every year, and let's say you have a family plan, you would be contributing 5.5% of your salary towards the New Jersey Educators Health Plan. So there, in and of itself, there is a change or a difference or a savings there. So something to really consider. But while you will have savings moving into the Educators or Garden State Health Plan, there are plan differences that you certainly need to be made aware of. And that's part of our goal here today, is to properly educate you on what those plan differences are, because it's not a one size fits all. Everyone's medical needs are unique to them and their family. So we actually encourage employees to reach out to us as well one-on-one so we can have those conversations about how you are currently utilizing your benefits in your current plan and how that would be impacted by moving to a different plan. The Garden State Health Plan also has its own table of determining what those percentages are. So again, it's a percentage of your salary rather than a percentage of the premium. So just to talk about some of the plan highlights, all four plans utilize the same network of doctors. So if you're in Direct 10 now and you're looking to move into the Educators Plan, you will have the same exact network of doctors that you have now. So there is no disruption from that standpoint, that a doctor that you're seeing now that is a must-have doctor for you, that doctor will be in network under any of the other three plans that are offered. The Garden State Health Plan, however, only offers coverage in the state of New Jersey. That's something that we like to really emphasize and highlight because of Wallington's proximity to New York City. And we know that a lot of people in this area utilize doctors in Manhattan or hospitals or other providers. The coverage for the Garden State Health Plan would not cover you in the state of New York. So that's important to note. If you also have dependent children that are away at college and they're out of the state of New Jersey, that's important to note because they will not have coverage outside of the state. The New Jersey Educators Health Plan, however, has the same national network that Direct 10 and Direct 15 has. So if you've ever gone if you've ever gone in network but out of state under the under the Direct 10 or the Direct 15, those would be the same providers under the New Jersey Educators Health Plan. So that's something to note. As we mentioned, contributions for the New Jersey Educators Health Plan and the Garden State Health Plan are based on a percentage of your salary rather than a percentage of your premium. Co-pays for those plans would be $10 at your primary, $15 at the specialist, $125 on the emergency room copay, but that would be waived if you're admitted into the hospital. The educators and the Garden State Health Plan also have the gym reimbursement that you have under your Direct 10, Direct 15. But again, the two big differences that we are going to highlight here a lot are the out-of-network and the prescription. So moving into the educators or the Garden State Health Plan from Direct 10 or Direct 15, you will have different coverages for out-of-network and prescription. So that's something that we have upcoming in the slides here. Out of network, which we are going to get into more detail, there are three services out of network that are capped at a certain dollar limit under the Garden State and Educators Plan. So if you go out of network for acupuncture, again for pain management only, that would be capped at $60 a visit. So anything that is billed above that by that provider would be your responsibility as the member to pay that bill in whole. Same thing applies to physical therapy. Out of network, if you go to physical therapy, up to $52, and chiropractic, which has a maximum 30 visit limit, would be covered up to $35. And again, these are out of network caps only specific to the New Jersey Educators and Garden State Health Plan. The reason you're saving a lot of money by moving into those plans is because the out of network is it's a less of a reimbursement to those out of network providers. And also, as we are going to discuss, the prescription has a smaller list of covered drugs as well. So we're going to get into that. So just to compare all four plans to one another, as we mentioned, in New Jersey, it is the exact same network. So no difference in the doctors that are participating in the network under any of the four plans. But the Direct 10, Direct 15, and the Educators Plan have national coverage with the Blue Card Blue Shield network across any of the 50 states. But the Garden State Health Plan does not have any coverage outside of New Jersey. So that's an important distinction to make. I know with teachers, sometimes you travel a lot during the summer or you're spending your summer maybe in Florida. That's a red flag if you're considering the Educators Plan because, again, there's no coverage outside of the state of New Jersey. Your primary care copays vary depending on your plan, but anywhere from $10 to $15. Your specialist copays, again, also vary, but again, very similar to what you currently have. Your annual physicals are covered at no copay in network, so please make sure that you're taking advantage of that. And your deductibles are also something to look into. In network, none of the plans have a deductible. A deductible is the amount of money that you're laying out before the plan begins to cover any of your claims. And in network, it is a $0 deductible for any of the four plans. But out of network, you do have different limits for an individual as well as for a family plan. So as you can see in Direct 10, Direct 15, it's 100 for an individual, 250 for a family, whereas for the educators and the Garden State Health Plan, 350 for an individual, 700 for a family. Out-of-pocket maximum, which is the most that you would lay out in a calendar year, also you have separate limits for that in and out of network. None of the four plans require a referral, so you can go to any doctor at any time without having to get a referral from your primary doctor. Your labs are the same across the board with all four plans, LabCorp and Quest being your in-network labs. You do have out-of-network benefits across all four plans, and they would be subject to your deductible and applicable coinsurance. Same thing applies for outpatient surgery, no charge in the network, but out-of-network subject to your applicable deductible and coinsurance. And your emergency room copays vary depending on the plan that you choose. But again, if you're admitted into the hospital, those copays would be waived once you're admitted into the hospital. Something that I also like to highlight while we're talking about emergency room, depending on the injury or the illness that you have, if going to the emergency room is really the most expensive place to receive care. So nowadays, with the amount of urgent cares that are available, I would highly encourage you to, maybe take the time and figure out which one is closest to where you live, because urgent cares have really come a long way in the last 5 years with the amount of services that they can cover for you there at a fraction of the cost, and they will get you at the door much quicker than going through the emergency room. So something to really consider, depending again, of course, upon the injury or illness that you're seeking coverage for. So when we talk about out of network under the Garden State and New Jersey Educators Health Plan, it's important to note that when you go in network under any plan, those providers that are in network are contractually obligated to only bill you your actual copay. They cannot bill you anything above that. But when you go out of network under any plan, those out of network doctors truly can bill whatever they'd like. In the educators and in the Garden State Health Plan, the reimbursement for out of network doctors is much less than you're currently receiving in Direct 10 or Direct 15. So, as I've spoken to members that are in open enrollment right now, we talk about how they utilize their plan to see what works best in their situation. I recently spoke to somebody who goes to family therapy out of network 3 times a week, and I told her flat out, this is not the plan for you. She will realize a nice chunk of savings, but unfortunately, those savings are going to be eaten away by the high utilization that she currently has with out of network providers that she's going to weekly 3 times a week. So it's important to see how you utilize your benefits because on the other hand, I've also spoken to members that go to 1 or 2 out of network providers once or twice a year. So in that case, you're probably still going to come out ahead savings wise because you're not really going out of network with a high degree of frequency. So again, important to know that. I see that I have a question here in the chat. A person says, for lab work, New Jersey Imaging Network charges for copay in the office and then mail a check back after a month. It wasn't like that before. I never pay in the office. It shouldn't work that way. New Jersey Imaging Network is a network. I personally go to them, to the one in Nutley. So they really should only be, they really shouldn't be charging you anything. If they're in network, they shouldn't be charging you anything. But reach out to us because it sounds like you have a claim situation that we can certainly look into to see how that was processed for you because that doesn't sound right. And maybe they don't have your updated card or they may have made a mistake in processing your claim. So reach out to us, to the individual who sent that. And you can ask for Karen in our office. She is our claims person and she is terrific. She is a true claims advocate for employees. Going back to out of network coverage, again, very important. Even if you stay in your direct 10 or in your direct 15, it is very important that you try and stay in network because that is where you can really control your costs. As a person who does insurance for a living, I have out of network benefits that are pretty nice too. I don't go out of network. I think it's incredibly, it gives me a lot of anxiety because I don't know what they're going to bill and I don't want to receive a surprise massive bill in the mail. So, again, something to pause and consider. So when we're talking about the educator's plan, for example, let's say you go out of network and that doctor bills you $100, which is highlighted in green. Horizon will go ahead and take a look at that reimbursement and determine what they would have paid out had that provider been in network, and they will determine what it would have been usual, customary, and reasonable UCR as the allowed amount for that covered service. And in this example, let's say they determined that it would have been $50. Horizon will pay their 70% of coinsurance, which is the orange box, which is $35. You as the member will pay $15, which is your 30% amount of coinsurance, and that is what accrues towards maximum out of pocket. But that other $50 that's part of this equation to pay that bill in whole is what is known as balance billing. That is your responsibility as the member to pay that provider directly to make sure that their bill gets paid in full. That does not get applied towards maximum out of pocket. And again, this is an example of a hypothetical example of just $100. Usually when people are going out of network, it's because they're going to a very expensive specialist. So it's important that you talk to that specialist before any service is rendered because you can certainly go ahead and have them do what's called a predetermination of benefits. So they can tell you, okay, this is what we bill and this is approximately what we expect to get paid from your insurance company, and this is what your balance bill will look like in order to pay this entire bill. So again, just a very hypothetical example, but we do like to take the opportunity during open enrollment to highlight that to members because it's pretty crazy out there what happens out of network. But ultimately, if you are in direct 10 or in direct 15, the reimbursement that you're getting now for an out of network doctor is going to be much less. So again, something to consider and reach out to us. We can talk through your situation to have a better understanding and give you additional guidance. The Horizon prescription plan, it's the same coverages that you have now, but if you make a plan change, it is a different list of drugs that would be covered depending on the plan. So in the Direct 10 and the Direct 15, you utilize what's called the Classic Formulary, which is a very large list of covered brand generic drugs, specialty medication. But under the educators and the Garden State Health Plan, they utilize a different list called the Net Results Enhanced Formulary. We have a link for this list of covered drugs on the IMAC portal. It's also available on Horizon's website. But with the educators plan and the Garden State Health Plan, they cover a smaller list of drugs and require the use of mandatory generics wherever possible. So, for example, if you're someone who maybe has a cholesterol problem and your doctor writes Crestor on the script, Crestor is a brand. Crestor is excluded from coverage under the educators or the Garden State Health Plan because there is a generic called rosuvastatin, and that is what would be covered. One of the questions that I get a lot is, well, what if my doctor writes a note saying that I need it, improving medical necessity? If a drug is excluded, it's excluded from coverage. There's no way around that. So that's why it's important that if you are in Direct 10 and Direct 15, take a look at what kind of medications you and or your family may be on. If you're okay with generics, that's perfect. There are certain brands that are covered, and I like to use Ozempic as an example. Ozempic, even though it's not a generic drug, it is covered right now because it has no generic. That's not to say that every brand that doesn't have a generic is covered, but Ozempic, which I know is a very popular drug for diabetes right now, I know that that is covered at a $10 copay. Generics are covered at a $5 copay under the Educators or Garden State Health Plan. So again, those differences in prescription, like we discussed with out of network, prescription also functions differently. We want to make sure that come January, if you're making a plan change, that the plan is going to work for you and cover the medications that you and your family may need. So either take a look at the online list of covered medications or reach out to us. It's important that when you're reaching out to us, if you want us to look into what medications and how they would be covered, let us know the dosages as well. I was actually working with a member this week who was on a generic drug in the Direct 10, and they wanted to know how it would be covered under the educators plan. And believe it or not, a 1 milligram versus a 5 milligram of that same generic, one was covered, one was not. So it's important to also let us know the dosages so we can give you the correct information. But what I tell people is you're definitely going to have a savings moving into the educators or Garden State Health Plan. But again, it's important to note that out of network and prescription are red flags. But if you're someone who primarily stays in network and you don't have an issue with generic drugs, it's a terrific plan. So something to really consider. Also, with regards to the New Jersey Educators Health Plan and the Garden State Health Plan, is that it requires step therapy. So even within the world of generics, for example, there are lesser expensive generic options available. So depending on the drug and depending on the condition, you may be required to try certain generics first before being able to move up the ladder, if you will, in step therapy. What I also like to mention to members is that there will always be a drug for every single condition. So it's not like, hey, if you have asthma, we are not covering inhalers. No, there are medications for every condition, but it's important to make sure that you know what's covered and not, because, for example, I've worked with people that have diabetes, and certain insulins are covered and certain aren't. And if you know anything about diabetes, it's a disease that you can't just willy-nilly change your insulin from, overnight. So it's important to, again, have those conversations about how your drugs are covered. And if you're truly looking to move into the educators or Garden State Health Plan, maybe you'd want to talk to your doctor about, hey, this drug that I'm currently on is not covered, but what would be in that same therapeutic class of drugs? And they can go ahead and make some suggestions. We can look into to see how those drugs would be covered. But again, please feel free to reach out to us. We want to have those one-on-ones with you to give you all the information pertinent to you specifically. So as far as next steps, if you're not looking to make a change, there really is no action required on your behalf. But if you are looking to make a change, or if you're looking to waive your coverages for 2026, you would have to complete either an enrollment or a waiver form. We highly encourage everyone to utilize the IMAC portal to review how the plans compare to one another. We have the link for the formulary to see how drugs are covered under the educators versus the Direct 10. And also the New Jersey, contribution calculator is available for you to see what your savings would be by moving from one plan to another. This is your annual open enrollment opportunity. You are making a plan election for the 2026 year. And again, as I mentioned earlier in the meeting, if you, let's say, are in Direct 10, you move to the educators for 2026, and come next October, you realize, hey, you know what, I didn't save as much as I thought I would be, or I'm starting to utilize more and more out-of-network doctors, or maybe you've had a change in the medications that you take, you would then be able to go ahead and make a plan change for an effective January 1st, 2027 date. Again, if you're making any changes or waiving coverages, please make sure that you're submitting those forms to Adita in the Human Resources Office by November 21st. So again, that week before Thanksgiving. As we've been referencing quite a bit throughout the course of the webinar, the IMAC Benefits Portal really is one-stop shopping for anything related to your health benefits. Forms, wellness links, contribution calculator, plan documents, everything you could need regarding your plan is on the IMAC Benefits Portal. So please make sure that you bookmark that or jot down that information, imacbenefits.com, and the guest key is Wallington PS, as laid out on the screen. As I also mentioned, the contribution calculator, which looks like this, is also on the portal. It is an Excel document, so if you don't have access to Excel and try and open it, let's say with Google Sheets, it will not work. Reach out to us. We will go ahead, whether you call us or you email us, we will run those numbers for you and let you know what you will be paying in January for Direct 10 versus what you would be paying in, let's say, the educators plan. We do that all the time, and we'd be happy to do it for you as well. And while we know that this is your open enrollment opportunity, we understand that life happens outside of open enrollment. So just as a reminder, you do have 30 days from the time that you have a qualifying life event, 60 if you have a newborn child, to complete and submit your enrollment forms to the Human Resources Office, and your coverage is retroactive to the date of the event. So if you have a baby, you have 60 days from the time that baby is born to add them onto your plan. If you miss that deadline, you would be obligated to wait until the following open enrollment period. Same thing if you get married. With marriages, divorces, loss of other coverage, you have 30 days to go ahead and make those changes. If not, you would have to wait until open enrollment, which happens every October with changes taking effect January 1st. We also like to take this opportunity to go over what options dependent children that are aging out have. So dependent children age out at the end of the calendar year in which they turn 26, and when they age out, they may have the following options available to them. COBRA, which is automatic, they will be mailed out COBRA notification if they want to continue their coverages. And I have to tell you, COBRA is very expensive. I literally just had a conversation 24 hours ago with a father whose son is aging out, does not have another job. And when I gave him the COBRA pricing, he really thought it was an annual fee. That is how expensive it is. It is almost the equivalent of a mortgage payment. So it's something that I like to highlight. Uh, if your dependent child is over the age of 26, has no dependent children of their own, lives in the state of New Jersey or is a full-time student elsewhere, and it does not have access to any other group coverage or Medicare, Chapter 375 is a great option for them. It is 60.8% of the cost of the premium, so much less than COBRA, because COBRA is 102% of the premium. So there is a significant savings if your dependent child does not have any other coverage options, especially with what's going on now in the marketplace. The marketplace itself is also facing very large increases to their plans currently for 2026. So again, Chapter 375 may be an option for coverage if you're looking for that overage dependent. And if you have a child with special needs, there is coverage continuation for overage dependents with disabilities. If any of these three situations apply to you, I highly encourage you to reach out to us. We have all the forms on the IMAC portal, but if you have any questions about how to complete them, where to submit them, please reach out to us. We will walk you through that process. And again, for Chapter 375 or Dependent 31, as it's also known, that's a New Jersey state mandate. So again, if your child meets that criteria, they would be eligible to continue in the same plan that you are on right now for medical and prescription only. But again, at a much lesser cost than what COBRA is. And we have the form and the link on the IMAC benefits portal. You can also go ahead and search for a doctor through the horizonblue.com website. But as I mentioned, all 4 plans offered at Wallington Public Schools utilize the same network of doctors, which is called the Horizon Managed Care Network. So everyone that is in network for you now will be in network for any of the other plans that you choose to enroll in. Same thing for Horizon Be Fit. This is the gym reimbursement program that is available to all members, no matter what plan you're in. By going to the gym 3 times a week or 12 times a month, you can go ahead and submit to get reimbursed for a $20 a month incentive, up to $240 a year for doing a wellness activity like going to the gym or even taking steps. I know that doing your 10,000 steps a day also qualifies for the gym reimbursement. So something to take advantage of. Also, as a Horizon member, you have the Blue 365 discount program that's available to all members. So if you go to Horizon Blue 365 deals, you can sign up to get emails on discounts from anything like a meal delivery service, LASIK eye vision, etc. It's a whole great network of savings that's available to all Horizon members. So definitely take advantage of that. And also the Horizon app. I always like to mention that Horizon does have a really great app. If you've never registered for your Horizon member portal, you would need to do that first on horizonblue.com, but you can use the member app afterwards, which is really neat because it's like having your ID card on the go if you forget your wallet or purse at home. And with that said, that really does bring us to the end of our webinar. I really appreciate everyone's time today. I don't see a lot of questions here. But if you think of anything afterwards, I highly encourage you to reach out to our office. Again, open enrollment ends Friday, November 21st. We want to make sure that we are connecting with you before you're making a plan change, just so you have all of the information in front of you to make an informed decision. Thank you so much. We look forward to hearing from you and have a great rest of your day and happy Halloween too. Thank you so much.